If you haven't come to Health Council Talks before, I'm Sharon Finarelli, the Executive Director of the Alliance of Health Councils, and I'm really happy to see everyone here today. This is just a really great opportunity that hardly ever happens for health councils to talk to each other in chat, to ask questions, to share information, and we try to get opportunities for you to have a resource presented in Health Council you haven't been aware of before. And today we have a packed agenda. We're going to start with Dr. Tracy Collins from UNM's Academic Health Department. You may remember her is just a couple of months ago, she was our Department of Health Cabinet Secretary. So I'm really pleased to welcome Dr. Collins. And are you ready, Dr. Collins?
I am. Good afternoon. Thanks so much for allowing me to speak for a few minutes. I realize you have a packed agenda, and so I'm going to try and be brief. I'm not showing slides either. Really what I want to present to the group today is just a little tickler, a little taste about what we're planning at the College of Population Health, and that's the formation of an academic health department. And really an academic health department is really a formal affiliation of a health department and an academic institution to train future health professionals. And for New Mexico, it's both UNM working with DOH and also NMSU. So technically we'll have two academic health departments to really improve how we're teaching and training our future workforce and to enhance our research partnerships. And so really overall, the development can strengthen academic programs and practices, provide additional student opportunities, and provide collaborative opportunities that really can have a positive impact on state health. We have four major goals with the Academic Health Department between UNM and DOH. One goal is to strengthen our biostatistical support for the state. So we'll be hiring a biostatistician to really help with designing, analyzing, and implementing studies. Our second goal is to inform the practice of public health, and we will be hiring a community engagement and participatory research trainer to really support training development needs throughout the state in the area of community engagement and understanding how to conduct that type of research work with the community. Our third goal is to increase capacity for real-world experiences for our students. So really providing them with more fieldwork opportunities by partnering more closely with DOH. And finally, we want to increase research capacity for DOH. And so we're going to be identifying about 1.5 FTE faculty with expertise that we naturally have in the college already: community engagement, health policy, EPI, and the community participatory research as well. So that's really what's going on with the college. And nicely, just yesterday, we were able to get all signatures on UNM's side. So now the contract is with DOH. It's been about 6 months to get this finalized, but now that it's with DOH awaiting their signatures, that really should happen before January. And I will stop there to see if there are a few comments or questions.
Can you tell us a little bit about how health councils might be able to use that resource?
Yeah, so as we're looking to increase capacity around the state in the area of research, and also to provide our students with more field experiences, if there are research or program ideas that the health councils have that they want to present to us, we could then figure out how we could make it work using the current funding from the Academic Health Department. Similarly, if you have opportunities for our students to get more applied experience in public health, that would also be a strength that you could bring to the table.
Great. Any other questions or comments from anybody else?
Yes, this is Bob Drycha. Will you have any sort of document that we'll be able to download to read up about all these four objectives and things like that? I can only take notes so fast when I'm watching a video.
No problem. As soon as we have the signed document, we can provide a copy that can be distributed publicly of what we're planning.
Okay, good.
And is this a long-term project or a short-term project? Is it related to grant funding or is it departmental funding?
It's really grant funding from the CDC. So we're looking at 2 years for now. But if we can show deliverables to the legislature, we could ask for recurring funds.
Okay, great. So that's similar to what health councils are experiencing.
Yes, there's a flurry of
And
money, a nice amount of money coming our way, but now it's a matter of sustainability.
Exactly. Any other questions? And I'm having trouble seeing everybody at the same time. It's not all fitting on my screen. So if there is a question or comment, feel free to put your question or comment in chat. Don't wait for me if you're raising your hand because I may not see it. Okay, well, thank you, Dr. Collins, for taking time to share your work with us, and we look forward to seeing how we can partner with the Academic Health Department. I think research is something that many health councils aren't really engaged in right now, so as the department develops, maybe we can have some conversations to talk about how best to connect to health councils and their work and do the research in a way that benefits health councils.
Absolutely. Thank you so much.
Thank you.
Okay, take
And
care.
so thank you. We're looking at today as a resource for those of you who are participating in the CDC initiative, or even if you're not, if you're working on supporting your community vaccine events or testing events. We want to be able to offer support to you. So we've been reaching out to DOH to look at how we can streamline around or other vaccine events. And you'll be hearing more information about that at the training on the 20th, how we can support that. The Alliance is working with CDC. Could we get incentives to hand out at vaccine or testing events? Things like water bottles, chapstick, sunblock, things that might promote your health council or this work. We're just kind of beginning those talks, but we wanted to be able to support health councils in every way we can. So that's another thing we're exploring. We're also talking to the schools and the FQHCs who support school-based health centers to see if there's an easy way for health councils to connect to vaccine events for school-age children. So it doesn't, we don't want you to have to feel like you're recreating the whole project by trying to figure out who to talk to, when to talk to them, what are you supposed to say, we want to make it easy for health councils to support their community vaccine events and testing events. So those things are in process and you'll hear more about that. But what's up next is Wendy Wintermute, who is our grants program manager and also Share New Mexico program manager, has come up with an idea that she thinks might be helpful. And she's going to describe her concept to you, and then you can give her your thoughts about, does this work? Is there a better way or something else that might be helpful? So go ahead, Wendy.
Okay, great. Let me share my screen. The first thing I want to do is show you some of the resources that are on our website. So let me find that here. I thought I had it up. Let's see.
So you can get to the website she's going to two different ways, either by typing in www.sharednm.org or through our Alliance website at nmhealthcouncils.org. And you'll also find a lot of other resources there if you haven't already discovered it.
Yeah.
So I'm going to let Wendy walk you through how to get to the shared directory.
Well, thanks. But first, I'm going to show people just a little bit on our on our Alliance website. You're referencing some of the resources we have. So can everybody see the page here, the Alliance page? Can you, am I sharing my screen?
A big arrow.
I know, I don't know what that big arrow is, but if you go to the top here, you'll see this page, COVID-19 update and resources. And if you click on that, are you following me? Did the screen change? I never know. Okay, so
Yeah,
here,
you're good.
okay, so we have two types of resources here. First, we have some breaking news here. Then we have two types of resources here. This section on the right has mostly statistical data, so you can see how your county is doing in terms of vaccination rates and cases. And I know there's tons and tons of ways you can get data, and this is one way. We're working on this, so we'd like to hear from you about which data sets, what kinds of data are most important to you. But I want to show you this one, COVID-19 recovery resources. So if you click on this, read more, you will see a number of resources that Madeline has posted on this website. It is a slideshow, so there's more if you keep sliding. I want to point out though right now, this one, find host a vaccination event near you, because that's what we're talking about today. So if you click on this, read more, you will
And that's
see.
actually what Janice is going to show you in detail in just a few minutes. But
Oh,
you
good.
can know that there's another way to get to it. She'll show
Okay,
you
great.
one way and there's the other way. Yeah.
Great. So we have, how do you request, how do you find a site and schedule vaccinations for yourself or your family? How can you request to host a vaccination event? And then resources for scheduling a vaccination. We put together a really quick checklist to see, and hopefully this will be handy for you. Just point out also that there's some specific information here about school events. But here's a little handy list of quick links. Please let us know if these are helpful to you, so you can have them all right there at your fingertips. So that was something we put together for you. I'm gonna move this down. Was that down there? Whoa. Now I want to get back to our resource recovery. So another resource that you have here is, if you click on the slider, Share New Mexico. This is the link to our website. I think many of you know it. We do have a number of, this goes directly to the directory so that you can search the directory by location, county, city, zip, by service category, or just by typing in a word like I need food in Lincoln County. And you can go there and search, and you'll get a list here. If you are registered and signed in, which is free and easy to do, you can export this list to an Excel file and manipulate it. I want to show you something we did by manipulating these files. So let me find that. Let me share my screen again. Did we track? Are you seeing my Lincoln County food resources?
We are.
Good. Okay, so I did an export for Lincoln County food, just the search I showed you. I took that Excel file, I did a mail merge and put it into this format. This is something we thought, if you community health councils are interested in having something like this to hand out at your vaccination events, our team, which is me and our two amazing MSW interns, can help you put this together. So this is a quick list of food pantries, the organization name, the program information, address, and phone number. So let me know if this would be something helpful to you. We have heard that food is the #1 resource that people are looking for at these events. But we also, of course, have other kinds of resources that we could help you make available to the people who are coming to your event.
So these are all places that serve Lincoln County, not necessarily in Lincoln County.
No, these
right?
are this list I'm showing you now are located, our resources located in Lincoln County.
Well, Chavez County Maternal Child Health isn't.
Oh,
And
sorry.
Roswell isn't.
Yes, you're right. Oh, Roswell is not in Lincoln County. It showed up. That's in Sierra County. So we can clean this up for you. Also, with feedback from you. Thank you.
And if they were looking for something besides food resources that
Mhm.
maybe they wanted to, health council wanted to hand out at a
Yes.
vaccine event or testing event, you could help with that.
Yes, I can, because we'll go back to the resource directory here and we'll do a search for you on whatever location or type of resource you would like to have. Okay, does that answer that question?
Great.
Clearly, I need to bone up on my geography, so I promise to do that. Okay, I'm going to stop sharing. But if you have any questions, please let me know. We'd be happy to help you use that resource directory to your best advantage. Sometimes it takes a little bit of tweaking to find just exactly what you're looking for, and we can help you do that. So 2 resources, the one on the NMAHC website, that handy list and other COVID resources, and secondly, the share resource directory.
Great. Anybody have questions? Something that you need that you didn't see on that website? And I've been looking through the reports, and several of you have already done vaccine events, and it sounds like most of you have, this isn't your first rodeo. Several health councils have done this before. So if you are a health council and this is your first rodeo, this might be a really good time to reach out and find people who've done it before, who can talk to you about what worked and what didn't work. And we've invited one of our health councils to do that right now. Rio Arriba County has done several vaccine events, testing events, and I'm going to turn it over to Lauren. And whatever your comment was that you had your hand raised for, Lauren, go ahead and share that, and then share what you've learned and what resources help you when you're planning vaccine events and testing events.
Well, thank you. Thank you, Sharon. And it's so exciting to be here. And I did have a question for Wendy, and that was, do we have to enter our events or do they automatically somehow populate?
No, Madeline, you kick in here, please, because Madeline's our event queen. And I think you have to let us know when you are scheduling them. Madeline, can you answer that question?
Yes, I can say that the events that we have posted on our site, we have to enter those in manually. So those aren't synced up with any resource, because we have a lot of events on there. You know, we have these trainings and we have our other trainings. And so each one is entered in there manually. So if you have a specific event that you would like us to add on there, just send it to me and I will make sure that it gets up on our page.
And just to add on to that, we have been talking about pulling out the community-based events, the ones that you are sponsoring. We have been talking about pulling those out of the various lists, because DOH has a list and we have a list, so that you'll be able to see at a glance what the other community health councils are doing. So we just started talking about doing that. If you think it'd be helpful, let us know.
Yeah, we have so
One way
many.
that would be helpful is just people sharing information. If they saw Rio Arriba County, if Health Council saw Rio Arriba County was doing an event, and maybe you're the county next to Rio Arriba, and you might want to come and see how it goes or what you could learn from them. So that's one way it would be helpful. But yeah, anybody who wants to post a Health Council event in our calendar, which is on our main page, just send any of us an email and say, please post this, and we'll take care of it for you.
Thank you. We have so many going on that I don't even have a list myself, but I will assign a staff person to keeping track and making sure that they're up there, because we are starting to hire CHWs, so they can do that. So thank you so much. I am really excited to be here. And let me start sharing my screen, something I'm not automatically good at. Here's what I'm looking for. Can you all see that?
Yes.
Yeah.
Okay. So, so the way we got into coordinating vaccines is our health council has a whole series of task forces that meet to solve various problems. And when COVID first broke out, and this is the pattern that I use for all the task forces, we immediately, it was in March of 2020, I think, or maybe it was 2019, I can't even remember anymore. but we immediately pulled together everybody that we thought had an interest, and we just asked them, what do you need? And we learned that between all of our clinics, we have 9 sites and 3 FQHCs. Not a single one of them had a mask. So we pulled together a group of sewers called Rosie the Respirators. And it was the world's most inefficient supply chain ever, which involved a lot of case managers and Vista volunteers and AmeriCorps driving all over the place to drop off supplies and pick up masks. But we started making masks. We also made face shields and gowns, and we even got donations of 80 hospital beds, and we distributed 10,000 masks throughout northern New Mexico. And then we moved on to coordinating testing. And then after that, it was vaccines. And so I have created a checklist that it's specific to vaccines, but it's basically how, when we convene any task force, how we do it. So the very first question you need to ask yourself is, who will you need at the table? And so, and this is already a little bit out of date because the Department of Health now has a group doing mobile vaccination clinics, a private group. So I imagine the DOH would, I don't even know what their name is, but I imagine the DOH will put us in touch with them and they have to be on this list. So just to start with, I would include the DOH. I would include every school-based health center and federally qualified health center, and they're usually the same, that is serving the population you're looking at. You need the hospital at the table, whatever emergency management groups you have. So we have the city of Espanola, the county of Rio Arriba, and sometimes I also reach out, if we're going to Dulce, to the Jicarilla Nation, to their EMS. And you need the person who controls the venue. So this is especially important if you're going to schools. We learned this the hard way. We started out with everything by talking to the administrator of the FQHC and the school. And then what ended up happening was whoever was running the school-based clinic, whose name we didn't even know, would reach out to the school principal, and we'd have 2 competing events, like 2 days apart from one another, and it confused everybody. So you're going to need to find out from the administrator of the FQHC and the hospital who's actually going to be doing the work. Whoever's coordinating it for them is who you want at the table. You absolutely need your school principal at the table. And if it's a janitorial, like at the college, Northern New Mexico College, we need whoever is in charge of maintenance at the table. So you're going to want to get your hands-on people at the table. Then the next question is, where are you going to hold the event? So for a vaccination clinic, you need either a large, well-ventilated room with 2 separate sets of doors and enough room for observation. And so this usually means a gym or a cafeteria. Schools are often the best places to do this. So we're usually, if we're indoors, sometimes we'll use a community center. Often we will use Northern New Mexico College's gym, or we will use a school gym or college. And then, so you'll need 2 separate sets of doors, one for entrance and one for leaving. And you need space for observation. So bleachers are great, because what you want to do is you want to separate people, and you're going to have an EMS team with a crash cart. So that's where your EMS directors come in very handy, because they can get an ambulance there for you. Also, your hospital can. Another option, if you don't have an indoor venue, is a huge parking lot where you have separate room for entrance and exit, and you have room for cars to line up. You will often have to loop them around. We use the college for that too, because they have so much room, and we can route people properly so that you don't have people trying to enter and exit at the same place. So then you are going to need to ask, how many people do you expect and how old are they going to be? And that's really important, because the dosing is very different for 5 to 11 and for 12 plus. And once we get down to 2 to 5-year-olds, I imagine you're not going to want to give them an adult dose. So you're going to need to know exactly how many doses and how many doses of which vaccine. And part of the issue you may have to deal with is how you transport it. So generally to our events, there are one of two things that happen. Either the DOH will give the vaccine to a clinic or the hospital and they will bring it. And they have to have full control over it because they need to make sure it's at the right temperature and it's not, some vaccines can't be jostled around, et cetera, et cetera. You can imagine that that is very challenging in rural areas because we're bumping over dirt roads. So these are all things to consider. The other, if they don't give it to the hospital, the DOH may bring it out themselves. So those are the two ways you're going to get your vaccine. And so how do you know how many people to expect? One of the things that we do at schools is we send out the permission slips that's the wrong word. It's not a permission slip, but it's the DOH consent form in English and Spanish. We send them out at least a week in advance and we track how many come back. And we expect that more people will show up than actually return their consent forms. And we make sure that we have enough volunteers present. Usually EMS will supply these to help get those consent forms over the phone for people who just show up and didn't do it. So if multiple agencies or ages, what is your safety plan? You absolutely want to be very careful that you are not giving the wrong dosage to anybody. So if we do multiple ages, which we frequently do, we have separate tables for 5 to 11 and then for 12 and up. 12 and up are considered adults. Once we have babies, I think it will be 3 tables. And so for when we do the younger kids, the 5 to 11, if possible, we try and have parents present because some of the littles are afraid of vaccinations and it's much easier if they can sit on mom or dad's lap. So you want to make sure if you have little kids that you got enough volunteers around to adequately supervise them. And to comfort anybody who's afraid of having their arm poked with a needle. How many vaccinators do you need? Who is bringing them? This is a really important question. I often find, so right now the hospital's overwhelmed, as are all of our hospitals, and some hospitals won't even participate because they really have to focus all of their staff on being in the building because all their beds are full and they're seeing people in their ER and hallways. So oftentimes it's the FQHCs bringing the vaccinators. I also have a couple of nurses that volunteer. I have a nurse who is on contract to do something else and I will call on her. And I have a medical assistant who works for me doing something else. And so I will use those 3 people to supplement whenever I can. But you may want to get a list of maybe retired nurses or in your community or retired medical assistants who are willing to come out and staff those events. And you just call them when you know how many people you need. We find that we need some folks to do the vaccinating and then some folks to prepare the syringes, et cetera. Then you need to know, and you want to make sure that you have a Zoom or some sort of coordinating meeting with these people present so they all know where they're supposed to go and when. What is the date and time of the event? Very important. You want to get that fully settled. When we're working with schools, it can be really challenging. So for example, in Espanola, we have 2 schools right next to each other, Los Niños Kindergarten and Espanola Elementary. What we've been doing is we have everybody show up in the morning at Espanola at Los Niños, where we see the 2 schools. Then after lunch, we move everybody over to a different school, Fairview. And you are also going to have to keep in mind that as you plan your event, you're going to need to set 2 dates. One is the date for the initial primary vaccination, and then you're going to have a booster event 3 weeks later. So like you don't want to set it up so that, let's say now it's a little late and you don't have to worry about it, but we were doing this in October, November. So we had to be pretty careful that the 3-week period didn't fall over Christmas or Thanksgiving break. You want to be able to do that when you're going to have people present to do it. And now you even have a third booster you have to think about. So that wasn't, when we started planning, that wasn't part of the scheme. I don't know how, I think we're just sending people to CVS at this point for their third booster. So who will bring and retain responsibility for the vaccine? I already covered that. You're going to want the DOH at the table. They will help you with this, but either the mobile vaccine team is going to do it, or the DOH will give the vaccine to your federally qualified health center and they will bring it and be responsible for it. But it has to, like, we can't give it to our EMS director. It's got to come from a health agency that is already set up by Department of Health. How many volunteer support staff will you need? Another really important question. Do you need people to do initial registration? How many? How will they work? You got to make sure that you have the correct laptops or printers available to you. Sometimes we've even had to think about stuff like who's going to bring the extension cord and who is either going to bring a thing to put over the extension cord so people can drive over it, or who's going to build one. So your EMS guys will be really good about that. They will know what equipment you need, and then you just need to write down exactly who is going to provide it. Do you need people to monitor, looks like I forgot the verb there, automobile or foot traffic? How many? If you're doing something outside, you absolutely need people, and you're going to need orange cones and brightly colored clothing or vests so that they can tell people where to drive so you don't get chaos. Also, if you are doing it in a gym, you may need somebody outside telling people where to go so they're going to the right entrance, and you're going to need good signage. You're going to need to know who is making the signage and who is putting it up. Will all these people be easily seen? That is really, really important. You don't want to run anyone over. Do you need observers? This is also important. So if you have observers, you got to make sure somebody is going to bring a crash cart and an EpiPen. It may not necessarily be all of your observers. So you might, let's go back to the school. You might have a few kindergarten teachers present. They're not going to have an EpiPen and a crash cart. You got to go to your hospital or your EMS guys or your volunteer fire department. The fire marshal in our county is really good about that. So he's a very helpful person to have at the table. What equipment will you need for this event? Who will bring it and who will set it up, and when will they do this? So for some of our events, like when we first set up testing at our college, I already told you about the whole issue about the extension cord. A real question was, okay, we're going to have computers set up, and this is outside. And we're also going to have printers. How do we attach those to power? How do we make sure that they stay attached to power and nobody drives over the cord? Maybe you need some kind of a cooler. Who's going to bring the cooler? How are you going to make sure it stays attached to whatever you need it attached to? Who's going to monitor it to make sure the temperature is stable? So these are all things to think about. If your event is in a school, you will need to send home the DOH consent form with the students and then keep track of how many and which ones are returned. So our very first event, set of events in schools, what happened was school administration sent out the form. Nobody kept track of who was bringing it back, and nobody explained what the form was. So it worked much better when we sent home, when first we did robocalls, because almost all your schools have the ability to do robocalls. So they robocalled all the parents, and then, and told them to be on the lookout for the consent forms. We made a flyer in English and Spanish and sent it with the consent forms. And then we did robocalls again to remind them about the consent forms. And then we also had somebody on hand because the DOH will allow us to do the consent by phone. And so doing this boosted our participation from 2 people showing up for an event to 150. So and I just can't tell you how important it is to really get that information out. What is your advanced publicity plan? Are you using flyers, radio? Who will be responsible? So in addition to producing the flyers for each event, I go on the radio. It's the KDC allows me for free every Tuesday and Thursday at 7:30. I announce all the upcoming events, what the parents will need, what they can expect. If we have no events, I talk about something else having to do with COVID. But we regularly put that out, and we also regularly talk to our newspaper so they can do stories on it. So you do need to assign it to somebody. Just don't expect the schools to send the flyers out unless somebody's tracking it for you. Finally, and this is something that we also plan to start doing. Do you need a listening session with a health professional prior to the event for parents or others? Who is doing this and when, and what is your publicity plan? So we're getting in Rio Arriba down to, like, we have 99% that have had their first shot, and we have 87% fully vaccinated. So now we're getting down to the people who really aren't doing it for some reason or another. And so we're actually exploring the use of motivational interviewing. We're going to be working with Cerna Solutions on this, which we have used very successfully to help families get their loved ones into substance abuse treatment. We'd like to see if maybe we could use this also to encourage people who are afraid of being vaccinated. But one thing we could do to start is holding town halls, probably primarily via Zoom, if it's possible. Some places we may have to actually go door to door or do it in person because people don't have internet access. With somebody like Dr. Ogren, sadly for us, retired, but somebody like Dr. Ogren, or even better, a healthcare professional from their local clinic whom they already trust, that they can ask all their questions. And you don't want to poo-poo anything they're saying. You really want to validate their concerns and then try and answer them as best you can. One of the people here who does it for us is Dr. Bayardo at the hospital. Everybody knows him and loves him. And then you're going to want to publicize that in advance. So you're going to want to know who is doing it and what is your publicity plan. How are you going to make sure that you're reaching the targets that you need to reach? And that is pretty much how we pull something together. I also write up the notes and then I send it out to everybody who was on the planning. And then you also want to remember to call all your volunteers the day before and remind them. And also email them and also text them. So you can't do it too much. So, and then I just leave the list open so they can all ask each other questions too. So if we have an email thread or a text thread going, they'll all ask each other questions, and then I don't even have to do anything after that.
Oh, Lauren,
And-
you have a question from Brenda. She's asking, is the DOH consent form for adults too, or just youth? Do you need 2 different forms or just the same form?
I think it is for youth, and we've been using it with the schools, but I think actually there is a DOH consent form. I think you do have to do it for adults. So I think you do have to get written consent from everybody before you vaccinate them. I would just give it to everyone. That way nobody can come back at you and say, I didn't agree and you just snuck up on me and jabbed me with that needle. And we haven't had that happen, but you never know.
And then Holly's posted an article if anyone's interested on using best practices to address COVID-19 vaccine hesitancy, the case for motivational interviewing approach to back up what Lauren's saying. So thank you for that, Holly. Any other
Thank you,
questions?
Holly.
or
Yes, and
comments?
just so to
Yeah.
elaborate on motivational interviewing, basically what you're doing is you're meeting the person where they're at. You are validating their fear, anger, concerns, whatever else is going on. And then you're asking them a series of questions, that, how can I help? Or you're answering their actual questions, and you're just helping them to think about it in a different way that takes into account and validates whatever their concern is. So what you're doing is you're removing the obstacles, and you are providing support for doing it the way you want them to do it.
So we have 3 hands raised. First is Susan, then is Chris, and then Matt. So Susan, do you want to go?
Sure. Excellent presentation, Lauren. Thank you so much. I just wanted to comment, and I also put it in chat. For those of you who are filling out your vaccine equity action plan, what Lauren presented really puts for you, those tasks within your action plan. If you're going to be sponsoring or co-sponsoring a vaccine event, you may not have to do all of them, but she's touching on a lot of the key steps. If you don't have the capacity to sponsor or co-sponsor an event, you might just take one of those steps that Lauren just reviewed. And so maybe you're just going to gather volunteers to be observers. Maybe that is your activity. So excellent ideas, and thanks for sharing that, Lauren.
Thank you, Susan.
Chris, you're next up.
One is a question, and then one is just a piece of information that may or may not be relevant. Lauren, I'm so glad you mentioned the doctors who might talk to the community. We were asked the other day by one community group to try and find a list of what you might call community-oriented, trusted physicians that people knew, in case other people, other groups out there wanted to have like community conversations, question and answer sessions, platicas, or whatever in that. If any of you in your own areas wish to send me the names of any physicians or medical personnel like that, I'm trying to create a list with the health equity specialists and whatever for that purpose. But if you don't want to, that's also fine. But we just thought that might be very useful for communities. The other one is, I apologize because I actually have not been out at any of the vaccination sort of events. But another group I was working with the other day brought up to both Roberto and Dr. Perejón the fact that a lot of the forms that people need to fill out, I don't know if those are just at the events, I do know they're at the pharmacies, that a lot of those forms people need to fill out to get the injection are only in English, are very small, tiny, hard to read, everything else. So Roberto said that he was going to take it on himself to try and get the forms translated into Spanish. And then another point that was brought up was somehow or other to provide basic information, maybe a card or something that goes on the form that says to people, you do not need to put your driver's license, you do not need to put your social security number and other things, so that people actually know their rights around the fact, like I, for instance, was asked for my Medicare number, which they shouldn't have at all. So I just wanted to say some of those are coming up, I hope.
That's
Chris, would you
awesome.
please
Thank
put
you.
put your email in chat in case anyone does want to send you
Great.
a list? And then Matt, and then we're going to move to Janice.
Lauren, great information. Thanks for going through. As I've been working many sites, it's a lot of logistic questions you're correctly addressing. One thing, another lesson that we've learned in many of these places, that your support group will need to be in constant communication with walkie-talkie to your vaccinator or the lead head nurse, because The tricky part of doing lots of advertising is that you don't know how many people unregistered will then come. It's great to accept them, but because the doses need to be accurately counted so that you don't have 50 people showing up and waiting, and then you don't have enough doses, that communication needs to happen, and knowing for the people receiving how many non-registered people you can accept so that people stay happy and not wait for an hour and say, oh, we're 20 under, and then what? So that's one little detail that we've learned of. Those people need to be talking so that non-registered can still be accepted if you have the doses available.
Fabulous point, and I will add it to this checklist. And Sharon, I'm wondering if maybe we could put the DOH consent forms in English and Spanish up on the Alliance, so people could, the website, so people could pull them down, and I will fix the checklist, and we could probably put that up there for folks too.
The Spanish should be somewhere because we hand out the hard copy Spanish all the time.
Yeah, no, it definitely, I can send it. Dr. Ogren gave them to us in English and Spanish.
Great. Thank you, Lauren. Thanks so much. And if you would stop sharing, then we have Janice Chino Acton, who is going to tell us about the NMDOH link for scheduling mobile clinics. And you see the stop share button?
No, I don't. I'm trying. Where is it? I
So
see
you
new
go
share.
up- So if you click the arrow beside of share screen, you should have an option to stop sharing. And Janice, go ahead and try to share simultaneously, because I'm telling it more than one person can share, and we'll see if it overrules Lauren while she's figuring it out.
Yeah, I don't know what to do. I'm pausing share. Is that good? Does that work?
No, I think it should be in stop share.
Oh, I see it.
Okay.
Okay.
I learned a new
here we
trick. Thank
go.
you.
I just wanted to quickly say that I posted the link to Lauren's tip sheet. It is on our website, but Lauren, if you could send us the updated version, we will substitute that for this, and we'll also post those forms in the same place. So thank you.
Awesome. I'll send you all of those. Thank you, Wendy.
Okay, Janice.
All right, so I'll try to make it as quick and painless as possible. First of all, I would like to acknowledge that Lauren's list is very, very useful, especially to our teams and being that supplemental support. With our mobile teams, you won't have to worry about half of that stuff, but it's always great if you want to go ahead and have providers on your side and doing that themselves. And then also, just for y'all's awareness, there are Spanish and English consent forms on our specific sites, and usually we handle everything by technology, with the exception of those, but there's Spanish and English. And so I would encourage people too to actually go see what's on the different sites. So if they're seeing something lacking on one site, we might be able to help out with another if it's a DOH specific run site. So just wanted to make sure that I didn't forget about those. So to start off with, for those of you who have not yet heard about our mobile vaccine, I know many of you already have. Our lists and our calendars are getting pretty full, maxed out through the end of December at least. And so those of you who are still interested, you can go ahead and you can request an on-site event, which is this little area, which I'm showing you to the right of the side, if you're not seeing anything on your public calendar. So anything that you guys can do in support of volunteers or site space allocation, as Lauren had mentioned too on her checklist, would be extremely helpful to us. So that way we can better serve the community and there aren't those long wait lines. And we can make it a smoother flow on our portion. So there are some of those extensive questions here too. So that was also on Lauren's list. So if you want to do that, that would help out. If you are looking for other information or just a vaccine in your area, of course, you know, we have almost 5 different sites that we kind of direct you all to, but vaccinenm.org has been the most useful and the most simplified for the most part. So you can check out the vaccine event calendar. You can actually see where vaccines are closest to you in your area for the most part. Or if you want to host an event, then there'll be an option too on this site. And that is the larger. So this vaccine.org also includes places that are outside of DOH sites. So, and again, I'm sure that most of you have already heard of those. And so going back to the mobile units, for some of you that have heard, we are getting 4 of our FEMA mobile vaccine teams, and I actually borrowed this presentation from Dr. Patajon. I know she submitted it out, so it should be circulating currently. We actually just got our first FEMA bus yesterday, and we checked it out, and that's where I'm currently at right now. We're training our FEMA personnel to handle more of these mobile vaccine sites. And so it's essentially a Herrera coach type of bus. So we're a little bit more mobile than the FUMO unit, for those of you who were aware of our trailer that we had during the summer, which actually pumped out a lot of vaccinations. But this is a little bit more mobile because we are focused on that COVID equity portion. So there are places in the state that don't have a vaccine site within a reasonable distance. And so we want to make sure that we pinpoint those areas. So each region is going to get a bus along with FEMA staff, and then some DOH oversight and some supplemental support. So we're wanting to make sure that these are as successful as possible. We're still going to have our event request that's separate. So for all of those events where we just pop up at your site, you're already hosting an event and we're just kind of there as a nice bow on top, just for access for your clients. We're still going to have those, and that's that event request form. The FEMA mobile units, we're going to be doing a type of pre-schedule. So for those of you who are familiar with the City of Albuquerque block parties, which are essentially health resource fairs, those are the type of events that we're looking for. So we're also going to be looking at different areas around the state that have events like that are going on. So if you do have resource fairs or large events that are going on, you really want vaccines there, we're going to bring with us the promotion that we have with our contractors, idea peddlers, and our different communications and marketing. We're also going to be bringing that there. And we're working on banners right now for Spanish and English to put on the bus or to have around more so on these FEMA sites. So I think I tried to squeeze that all in, Sharon, as much as possible to allow for any questions, because there usually are quite a few.
Yeah, thank you so much, Janice. And part of our discussion this morning was how we're going to share the information with health councils. So if you didn't want to schedule a site, but you wanted a site that was being scheduled, we will be sharing information with you about where the sites are in your county so that you can help promote them. And then DOH is also supplying promotional materials that they will provide to you and to the event location. So you'll hear more about that at our training on the 20th. And I see Chris Hollis's hand up. Go ahead, Chris.
Sharon, you may have asked, you may have answered it, but Janice, I was just curious because Michelle Pacheco had told us that the original schedule that was floating around, that was a draft schedule and that there will be another one. But how can, let's say that either the health councils or other community organizations doing this, how can they possibly provide you with information that might help you in sort of doing those schedules in advance in particular sites? Because, for example, the one I'm really concerned with is that in the region of the Northwest area metro, most of the bus schedule was primarily in Bernalillo, as opposed to the 3 other counties right around it and everything. So I'm just wondering if you have a conduit in a way for sort of that input from the communities.
So the first thing that would be very useful is an actual site that we can park the bus at and operate at. That's one of the most important assets that we can ask for. If you're willing to have us just be there for 3 days, or if you have an event that you're going to do, our hope is to be there the 2 days prior to that, as well as the event. So that way we can have those small dosage amounts beforehand and also continue to promote your event. And then on the day of the event, then we'll still be there, but it'll also bring that extra communications and marketing for your event specifically. But if you don't have an event and you just have a site and you realize that your community is in need of vaccines, then let us know.
Okay.
Yeah, and then I'm also I know Chris, you're aware of her, but Liesl Gonzalez, she's actually part of our COVID equity team, and she's our vaccine community coordinator. And so I've asked her to kind of handle those requests, so that way she can also help people game plan. So if she's getting 2 requests that are in the same county and for some reason they haven't connected, then kind of linking them up and then supporting them to make it a bigger event to better serve those in their community. And then we'll go ahead and bring our marketing and our vaccinations there too.
Thanks.
We have a question in chat. Brenda is asking, are the buses only available when we have a resource fair? Could they go to a remote area of a county that does not have all of the facility things on the system? Lauren shared.
Right. So again, the events are where we can kind of latch on if you're having events in your county or community. But as I mentioned, we do have a focus with the FEMA for more of the underserved and those locations that don't really have vaccines in their area. Some that may have been missed around that first round. So as Chris mentioned, for those of you who aren't aware, our last FOMU unit, we only had one, and it was allocated to the Northwest region. But due to the sites that were offered up right away and they needed that schedule right away, they stuck to that area, unfortunately. And the only time that we did go out was for Cedar Crest, which I mean barely counts. So those sites are very pivotal in our scheduling, which I have a huge hand in too. And so I'm actually looking at all these different sites on Saturday to send up a possible schedule. That doesn't mean that it's going to be okay. But for example, I just met with the state police deputy chief yesterday. And so he provided a list of their different offices that are willing and able to provide us sites. And so we also know, though, for those of us who work with the underserved, that that might not be as appealing of a site just to attend to with different state police and whatnot. So we're still going to look around the community in those areas, though, and try to host like 2 events sometimes.
Great. And just the other resource that health councils will have access to soon, the NMCDC Community Data Collaborative will provide information about the areas that are underserved, and health councils will have log-on access to that. And you'll hear more about that in your upcoming training. So just know that we're doing everything we can to try to equip you, support you. And if you start to feel overwhelmed, don't call the Alliance. We'll be happy to make sure that it's very doable for you and that you feel really supported in your work. And I see Susie's hand, and we'll let you close us out. Susie, go ahead.
Thank you. Yes, I just wanted to reiterate something that I've kind of been hearing a little bit of in terms of the vaccination plan for those of the health councils that are contracted with the CDC. I just want to make sure that everyone understands that it's the plan that is due by the 5th. It's not that you have to have completed something. You just have to turn in the plan by the 5th. So rest easy. You're making a plan about your activity based on your capacity. And that's what it is that you'll be submitting. I've had a couple of questions about, what if we don't have anything done yet? So I just wanted to bring that up. Thank you for helping me with that. And that was all that I had to add. Everybody's doing amazing. I'm gonna just take this second. Oh, we're at our end, but everyone is doing amazing. But I just have to say that 65% of the participating health councils in the CDC project are involved in vaccine related events already. 65%, that is a big deal. So thank you everyone for your work.
All right, thanks everyone. We'll see in January when we learn about healthcare for all. So Friday of January, see you soon. Bye-bye.
Thank you.